Good afternoon, everyone. How are you? Hopefully good. All right. I am very excited to have this great turnout today. We have a wonderful speaker. This is Val Guzman. He's going to be speaking with us today all about Medicare and a lot of the changes that are going to be coming up for 2024. So I will let you get started.
Okay, thank you. So again, my name is Val Guzman. I am the Benefit Access Specialist with Age Guide Northeastern Illinois. Just so you have a little background, Age Guide, we are a nonprofit that we work with local agencies to provide services to older adults and people with disabilities. So just so you know, in Will County, the main agency that we work with is Catholic Charities. So just know if you ever have questions or if there was maybe some particular service you were looking for, always feel free to reach out to us, and then we can always get you connected with the local agency that would actually provide these services. But definitely more specifically, the program that I work with is called the Senior Health Insurance Program. It's a federally funded program that's all about educating people on Medicare, answering your questions, and then definitely during the open enrollment period, helping you compare your plan options for the next year. And then of course too, I try to do as many of these events as possible just to try to help you understand how Medicare works and hopefully try to find ways to save costs with Medicare. So I'll talk all about some of the changes that you can expect for next year and also into the future, because there have been a good amount of changes happening with Medicare over the last couple of years. So I'll tell you about some of those changes. So I talked about this a little bit. So definitely we'll start with maybe the slightly bad news, where there are certain costs that are going up with Medicare. So most of you may be familiar, there are different parts of Medicare. Some parts you do have to pay for, other parts you don't have to pay for. But for Part A, so this is your Medicare hospital insurance, most people don't have a monthly premium for this because if you work enough credits, then you get this for free. But it still has some costs if you don't have any other coverage, like having a Medicare supplement plan. So there is a deductible with Medicare Part A. It is going up about $30 compared to last year, so it'll be about $1,632. Even some of the per day costs, if you do have to stay in the hospital for a very long time, some of these costs are going up also. So if you don't have any other coverage that would pay for these days, for day 61 to day 90, you would have to pay $408, and then up to 150 days, you would have to pay $816 per day. But again, remember, if you have a supplement, usually it covers these days, and most of them do cover this deductible. But maybe if you're new to Medicare, or if you don't have a supplement, these are definitely some big numbers to keep an eye on.
Is nursing home, the fee of a nursing home included in any insurance?
So it depends. So just in case, the question was whether the fee of a nursing home is included here. If it's a short-term stay, so say if you have to go to a rehab facility for physical therapy, occupational therapy, that is covered under Part A if you've been in the hospital for 3 days. So yes, that'll be fully covered for the first 20 days. If you do have a longer stay, there is a per day cost unless you have other coverage. The big one is definitely long-term care. That is not covered by Medicare. Usually the only way you can have coverage for long-term care is with a long-term care policy or Medicaid. That's the income-based program that you would have to qualify for.
Yes.
Would the long-term care be after day number 150? Or what happens after day 150?
So after day 150, there are a certain number of, Medicare calls them lifetime reserve days. So you only get these certain number of days for your entire life where you can have some additional coverage. But those days, if you do use those up, then say if you've already used up those days and you have to, for day 151, you would have to pay for the full cost of your stay at the hospital if you don't have any other coverage. So that's definitely just something to be aware of. It's very unlikely. Usually hospitals are, their main interest is to get people out, to go to other, whether it's a nursing facility, or most likely they would talk to you about either transitioning into long-term care or sending you back home. I have seen maybe a few cases where someone does stay in a hospital this long, but it's very rare. But it's definitely something to keep in mind, that it does get very expensive if you don't have other coverage and you're in the hospital for a very long time.
So in other words, most people can't afford that.
So a lot of times what happens when it comes to the point where if even with Medicare, if things become too expensive or just it's impossible for you to afford it, that's where the Medicaid program, that's usually what kicks in or helps people afford that type of care. But usually the fallback is always Medicaid, even if your income is outside of the normal limits. So that's definitely when it comes to Medicaid, it's a little bit more of a complicated issue because there is a set income guideline to qualify, but if you do need long-term care or if you're paying full price for a hospital stay, most likely Medicaid would cover that for you. Okay. There's ways I can explain better maybe separately if you like, but yes, so if you do ever get to that point where your healthcare expenses are too much for you to afford, usually Medicaid can help you. Okay. Oh, and just so you know, so if you say if you don't have extra coverage and you do have to go to a nursing facility short term, there is also a per day cost after those 20 days, and next year it'll be about $204.
So basically, if you have alternates, like Blue Cross or whatever, supplemental, more than likely everything should be covered.
Right, yeah, for most of those supplements, they usually cover most of these charges. It just depends on which plan you have. But definitely the higher ones, like the Plan F or the Plan G, usually those cover all of these costs.
I still have my own. I'm still paying for me.
So that again, that depends. It depends on which plan it is, but some of them do cover additional days in the hospital, but usually not so much after you've used your reserve days. So it depends. Yeah. Sorry, it's with most things Medicare, there's always certain rules or complications. So I mean, if that ever happens to you, or if you ever get close to that point, I would say definitely talk to someone, either a SHIP counselor. There's always staff in the hospital. There's social workers or discharge planners. So there are always people that can kind of help you figure out what your options are. Okay. And so for Medicare Part B, also this cost is going up every next year. So this year was about $164. Next year it'll be about $174. The deductible also went up a little bit. I believe it was about $233. It'll be $240 next year. And something else, well, this more so took effect this year. So for anyone that does take insulin, most of those types of insulin have been capped at $35 per prescription per month. But there are some plans or some prescription plans that do charge less. So if you've noticed that this year, or if you do need this type of medication in the future, just know that going forward, the most that you could pay for each prescription for insulin is about $35. There are still certain types of insulin drugs where they can charge more. So this is definitely, since we are in the open enrollment period, it's good to check in with your plan to make sure that it is either within this limit, or if you do have to take one of those more expensive insulin drugs, it'll give you a chance to shop for different plans that might cover it maybe a little bit better. And something good to look forward to, especially for anyone that does take very expensive medications. This has to do a little bit with the donut hole that still exists, where after you reach a certain point of paying for your medications, there was before, they call it a catastrophic phase, where then your medications would get a discount, but starting next year, you actually won't have any copays after this point. Again, this mainly affects those that have very expensive medications because you reach the catastrophic phase once you've spent over $8,000 in 1 year for your medications. So that's still a huge amount, but just for those, especially for those people that take those expensive medications, you do have a little bit of a relief after that point, or after you reach the catastrophic phase. And for anyone that does have, maybe have as a lesser income and assets, and that does qualify for the program called Extra Help. And just for those that don't know, there is a program where if you meet certain income requirements, you can get discounts on your medications. You can also get access to plans that have a zero monthly premium. And what's happening starting next year is that the program has been expanded so that anyone that qualifies gets the full benefit. Because the way it works now, or for the next couple months, is that there are different tiers. So depending on which tier you fall in, there would be just a certain number or a certain amount of a discount. But thankfully, that's all going away, where as long as you qualify, you'll get the full Extra Help benefit. But just know, this mainly affects those that do qualify for the program. If you're interested in knowing whether you do qualify, definitely, I would say, check in with us, and we can always tell you what those income requirements are and help you apply. Okay, did you have a question? No, okay. And then something more so a little bit into the future. So starting in 2025, there will be a hard cap or limit on how much you have to pay for medications. So thanks to the Inflation Reduction Act, starting in 2025, the most you'll have to pay is $2,000 for the year. And even if you do take expensive medications, say if you have to refill your prescriptions in January or in the beginning of the year, they've also built in a feature where you can actually spread those payments out throughout the entire year. Or if you have a more expensive medication, I believe the threshold is anywhere between $400 and $700. They'll also offer you that, it works like a payment plan where you can instead spread out those payments instead of having to pay that lump sum all at once. This all starts in 2025, so in another year, just know that there will be this limit as far as how much you have to pay for medications. And another big thing that you may have noticed in the news is that Medicare is finally able to negotiate drug prices with the drug manufacturers. So there are certain drugs. They picked about 10 different drugs. One of the most popular, or just the ones that a lot of people take, is Eliquis. That one's just very expensive. So finally, Medicare is able to negotiate a better price for you. Unfortunately, you do have to wait until 2026, so another 2 years, before you see those price changes. But after that point, every year, Medicare is going to negotiate the price of a certain number of drugs, so you won't have to wait as long going forward. It's just that since this is such a new program, or this is a new legislation that was just passed last year, that's why it's taking just a long time before you'll see some of these cost benefits. But just so you have a quick idea of some of the other drugs that are being negotiated, Xarelto is another. Januvia is one of those insulin-based drugs that's still very expensive. But again, this is all starting in 2026. There will be just some much better prices for this. Medicare has also expanded how they cover certain vaccines. So certain vaccines, normally they would be pretty pricey. In particular, the shingles vaccine. Normally it was you have to take 2 doses of that, and normally it was about, I believe, about $200 per shot. But now Medicare fully covers that. So there are other vaccines. It's good to check in with your doctor, say if you were putting something off, or it just wasn't affordable to get certain vaccines. But most likely Medicare now fully covers most of the vaccines that you need.
That's in 24?
So that actually started in this year. But it will stay in effect going forward. Mm-hmm. For anyone that's new to Medicare or maybe hasn't joined Medicare yet, Medicare is also simplifying how you enroll in Medicare. This in particular applies to they call it the Medicare General Enrollment Period. That normally happens from January to March. And the way it worked before is that depending on when you signed up, you might actually have to wait a certain number of months, sometimes until June or July before your Medicare started. But they actually made it much more easy where as soon as you sign up, your Medicare coverage will start the following month. So thankfully they have made that change where you don't have to wait or maybe purchase other coverage. So just know if you do, or if you're new to Medicare and need to sign up, it will be much easier. Your coverage will start much sooner. Another thing they've expanded with Medicare is certain types of preventative care and screenings. So in particular, something like cancer screenings. Eventually, after a certain point, Medicare is going to fully cover these screenings at no cost to you. So this is another where it's going to be phased in over time. But as you see here, starting in 2030, some of these screenings will be completely free to you. So as the years goes on, you'll see that you'll pay less and less for some of these screenings, and then at some points, or in the next 5 years or so, you won't have to pay anything. 2030, right? Yeah. Unfortunately, for a lot of things with really in healthcare in general, and especially with Medicare, because since it is legislation at the federal level, just a lot has to happen before any changes take effect or even changes get passed. So thankfully things are happening, and it seems like they're going to hopefully keep working on this and make more improvements. But yes, it does take a lot of time for these things to get started. So mental health services are also have been expanded starting in 2023. The main benefit here is that you now have access to mental health services through telehealth programs. So say if you have either a smartphone, you can actually meet with a doctor through your phone or through your tablet by video, because there used to be restrictions as far as location or where you can go to get mental health services. But this is another where it's through telehealth, they have expanded the accessibility of these mental health services.
What about in-person services?
So there, it's still a little unclear, or I can't remember off the top of my head if it means you can now go outside of your region to get mental health services, but it is still covered under Medicare. If you're in, say if you're seeking services in Illinois, it still should be covered. It's more so, say if you maybe live too far from your preferred provider, you now have the option to do those telehealth appointments instead. And so I would say definitely the biggest thing, especially now during the open enrollment, is comparing your plan options. So whether you have original Medicare with a drug plan, or if you have a Medicare Advantage plan, now is definitely the time to compare those options. Even if you're happy with your coverage, it could be that your plan has changed. Sometimes plans get discontinued and you're automatically signed up for a different plan. Sometimes the list of drugs that are covered also changes. So I really recommend just taking some time to compare what your plan is for next year or what your other options are. Because as far as the drug plans, there are 22 different plans offered for next year. That is actually down. So they did cancel or discontinued 2 different plans. So I'll get to you. So just so you know, that list, or there is a list of drugs that I handed out to you. It does show which plans were canceled, though they have just a line going through it. Yeah, go ahead.
We still have a program where you're plugging the medications and still stuff that's when you sign up for.
Yes, so he asked if there is a program or a tool that you can enter your prescriptions and it would tell you about the different plans that are available. So that's actually on the Medicare website. It's medicare.gov. So right, if you have an account, the nice thing about that is it'll automatically fill in your medications, or it knows what medications you take. But if you're just starting out, you will have to enter those medications. But it does show you every single plan that's available. It'll give you a really good cost estimate of how much your plans cost. It even lets you enter the pharmacy so you can know which pharmacies give you the best prices, because sometimes there is one pharmacy that'll charge you a lot less compared to others. So that definitely, I would say if you're comfortable doing yourself, go to the Medicare website, but that's also something that us, with the SHIP program, we can help do that together. Okay. And so just so you have maybe a snapshot of the costs for these drug plans, the prices do range pretty widely. Something that's different for this year is there is a plan that actually has a zero monthly premium. So it actually won't cost you anything monthly. And in particular for anyone that takes mainly generic drugs, it could be that this plan actually doesn't charge you anything for your prescriptions for the entire year. So that's why I say if you're paying something for your plan this year, it could be that this new plan that doesn't cost anything saves you a little bit of money. But then on the other end too, if you do have maybe more specialty drugs or more expensive medications, sometimes these more expensive plans, even though you're paying more per month, it could be that those actually save you more because you're paying less for your medications.
And the deductible might be lower too.
Right, so some of the plans do have a lower deductible because the maximum, that's also going up for next year. This year it was about $500, but it's going up to $545. But I believe I have seen some plans with a deductible in the $200 range. But one tip there is if you are comparing the plans on your own, it doesn't necessarily help you to shop for a plan based on the deductible. Because there are certain drugs, especially generic drugs, where you don't have to meet your deductible in order for the plan to cover those drugs. So that just means they'll give you the discounted price right away without having to meet the deductible. So mainly just don't let the deductible scare you away from some of the lower price plans, because it could be that it does still cover your drugs better. Go ahead.
I happen to have this WellCare plan that says, it's got a big X in the column that says zero premium with full LIS. Could you explain that?
Yes, so she was saying, so she's enrolled in the plan that's actually has a check mark next to one of the benefits. So the LIS program, that's also that extra help program that I mentioned. So the reason it's crossed out is because for people that qualified for the extra help program, that plan was free or had a zero monthly premium. But for 2024, it doesn't have that benefit, or it doesn't work with that extra help program. So even if you do qualify, it'll still have a monthly premium.
So LIS means something about extra help.
Yep, right. Yeah, it stands for low income subsidy, but it's the same program. They just call it two different things sometimes. Yeah. But if it does have the full line across it, that means the plan was completely phased out for next year. And so like I mentioned, so on the Medicare website, they call the tool that lets you compare the drugs the Plan Finder. So just know you can compare your plans here, you can check your drug prices, but it can be a bit overwhelming because they throw a lot of numbers at you. There's a lot of information there about the plans. So just know that help is available through the SHIP program, either through Age Guide, or also there are actually a few or a couple other sites that offer the same free service. And just remember too, the SHIP program, we're federally funded, so we don't charge you just to answer your questions or to compare the plans, because I know there are a lot of services out there now that are offering this same service but at a cost. So you can call both us, you can call Medicare, so you don't necessarily have to talk to an insurance broker to get this information. Okay. Oh, another nice thing. So I think I was talking to someone earlier. So those Medicare commercials and ads that you see on TV, the mailings that you get, the phone calls that you get, Medicare is finally regulating how those plans can be advertised to you, how often those people can call you on the phone. So there is finally some relief coming. So this oversight just started at the end of September. So there are going to be limitations to how often these insurance brokers or salesmen can call you. There is their ads have to be just much more clear. They can't be as deceptive as I think they have been as far as how they advertise their plans. So just know things are, I think, going to start to get better. Like most things, I imagine some calls might still get through, or some of these insurance brokers may not necessarily follow the rules right away. But if they don't, Medicare does have some power to stop that behavior. So you even have the option to opt out of sales calls. So just know if you do get a call, you can tell them to stop calling you, and they actually do have to listen this time. So that's another good change that's happening with Medicare. Then I did want to spend some time talking about the Medicare Advantage plans. I know sometimes it's pretty split with some people really like these plans, and other people just don't want to talk about them. But I think it's important to at least hear what they are, because they are an option, but just so you're just more clear, and instead of just taking what these insurance companies and what these insurance brokers are telling you. Because I do get quite a few calls where usually it's having to clear up what these insurance companies are telling people, because a lot of times they are saying things that are incorrect. They are saying they're maybe overstating what these plans actually offer or what they can do for them. So I'll talk about these just so you're clear about what they actually are, in case you're interested, or if you need more maybe confirmation that these aren't for you. Because they are pretty popular. Over half of all Medicare enrollees are signed up for these plans now. So that's why I say for some people they do really work, and for others they just don't want to touch them, and that's really entirely up to you. And there are just a lot of choice with these plans. There are over 50 different plans that are available, and these are all through private insurance companies.
What's the cost rate?
So that's one of the things about these plans, is that most of them don't have an extra cost. So you do still have to pay for your Medicare premiums. Usually that's your Part B, but most of these plans don't have an extra amount that they'll charge you. And that's why in their ads they'll say that the plans are free, but what it really means is they won't pay, or you don't have to pay an extra amount on top of that.
That is deceiving.
It is, yes. It's a little confusing, but and even though you don't have to pay extra for those plans, those other benefits, they are technically real. So they do offer things like dental, vision, and you don't have to pay extra for those. But there are kind of other sides to that, and I'll talk about those next. So these work just a little bit more like maybe the employer plans that you had, or private insurance, where they have different types of plans. So they have HMOs, they have PPOs, they also have some of these more private fee-for-service plans and special needs plans. Definitely the most common are these HMOs and PPOs, but I think the special needs plans, those, if you have maybe a certain medical diagnosis or you have a certain condition, there are actually plans that specialize on those conditions, and they may provide extra coverage or extra benefits that aren't normally available through Medicare. So it is something to consider, or at least check into, if you at least want to know what your options are. And that's why I think how you brought that up about the cost, I think that's really where you should at least start, or maybe focus on the most, because for some people there will just be a clear cost difference whether you enroll in Medicare through the Advantage plan or stick with just regular Medicare. And that's why, so just so you have a picture of how it works, is so you still pay your Medicare Part B premium, but just most of the plans don't have an extra cost that you pay monthly. Usually these plans also include your drug coverage, and a lot of times they do charge less than the standalone plans, so it's just something to keep an eye out for, especially if you take more expensive drugs. Or I guess another thing to keep an eye out for, there are certain Medicare Advantage plans that don't include drug coverage. There, be very careful, because for a lot of those plans that don't include medication coverage, they don't allow you to purchase a separate standalone plan. Those are rare, so just be careful. You would notice if that plan doesn't cover medications, because it would give you an estimate that's just very high as far as your medication costs. So again, just be very careful. Most of the plans do include the drug coverage, but there are some that don't. And these plans, some of them do have deductibles for both your health benefits and also the drugs. A lot of them don't, so they'll give you the full coverage right away. But again, it's just another cost to look out for. And so for most of your benefits, whether it's doctor appointments or hospital visits, instead of the 20% that you might be used to with regular Medicare, there are copays or coinsurance that you have to pay for just about everything. There are some things that are free, like usually your primary doctor visits. Sometimes even specialists are free. But for most things, there will be copays for, like I said, for just about everything. But one of the unique things about these plans is that they do set what they call an out-of-pocket maximum. So this is a limit of how much you pay every year for your healthcare costs. And once you reach this point, the plan will pay 100% of the costs. So that is very different compared to original Medicare, because if you don't have a supplement, there is really no limit to how much you have to pay for your health care. Yeah.
Does that include that out-of-pocket maximum? Does that consider if you have an expensive drug?
So not your drugs. So unfortunately, this only applies to your healthcare benefits, but that's where, starting in 2025, even with the Advantage plans, you will have that $2,000 limit. But right, unfortunately, that doesn't apply to the cost of medications. I wish it did, but yeah, unfortunately it doesn't. Mm-hmm. Yes.
I have a question on with an Advantage plan compared to a regular supplement. Okay, as far as if you have to go from the hospital to nursing facility, and I had this experience last year with my friend, and they were telling me, the nursing home was telling me, get a regular policy, don't go with the Advantage. And that because change it over. But the problem is that they kept telling me, no, he's cut off now, and he has to go home, or therapy at home is cut off. Does that happen with regular supplement, or does it happen with all plans?
So just so you know, in case you couldn't hear, the question was whether original Medicare or the Medicare Advantage plans sometimes limit how much care you can get in a nursing home. Sometimes they are very pushy about getting people out after a certain number of days or weeks. It can happen with both. And unfortunately, that does happen a lot. There are actually some protections, some legal protections, that even if someone is in a nursing home short term, but even if they're not necessarily improving, a lot of times nursing homes don't know that someone doesn't have to be improving while they're in the facility in order for Medicare to still cover it.
Well, that's what they keep telling you.
Right.
You're not improving, so you have to go home.
Right, because
and then you have to go through this session through going through another service where they look it over and tell you yes or no, that you can stay or not stay.
Right, because it's actually the case that as long as someone is maintaining their current health status, or as long as they're not declining, they should be able to stay in that facility.
But how do you fight that?
So there is an appeals process. There is an appeals process with Medicare. So whether it is appealing a discharge in a nursing facility or in a hospital, I would say always question it or always bring it up either to the staff there. Unfortunately, sometimes you do have to seek legal advice to make sure they're not taking someone out of a hospital or nursing home before they're supposed to. There is actually a free legal counseling or service that can help you with that also through Prairie State Legal Services. You can contact us and we can get you connected with them. But yes, I would say just know that even if someone isn't improving, that doesn't mean you have to leave the facility. It's just that it requires sometimes a lot of advocacy on your part, or if you're helping someone, sometimes we and you have to educate the healthcare providers on what the rules are, because unfortunately sometimes they really just don't know how it works. Sometimes, but also, I forgot to mention, if someone's in a nursing home, there is also a program, it's called the Ombudsman. So they're a patient advocate for people that are in long-term care settings or nursing home settings. So they can also help with that type of appeal, or help the facility understand that they don't have to be discharged just because they're not improving. Or even if it's just because it's you think it's still medically necessary, maybe doctors are still saying it's medically necessary. That happens too, where sometimes doctors say that they should stay in the facility, but the facility is saying no, you have to go home. So through the Ombudsman, you can also get help with that.
I just wanted to comment on that, like with the Medicare Advantage programs, you have to request authorization for therapy. And a lot of times it's not the nursing home that wants to kick you out because they want that funding. It's the insurance company saying, well, this person isn't improving, so we're not gonna authorize you for any more days.
Right.
So with the traditional Medicare, you actually don't have to ask for off. That's why when people go to the nursing home, they want you to get like traditional Medicare because you can use all your 100 days that you have, or your days
Right.
1 through 20 that are free, and the days 21 through 100 that are the copay. So that's why they want you to switch over, because they don't have to deal with requesting off from, a nurse case manager.
Extra time, yeah, yeah,
But you can't, like you said, you can't appeal it, but even if you do appeal it, they still have that nurse case manager that may say, well, she's not improving, so we're not gonna give her authorization for any more days.
They would rather get you out of there and then, but then when you go home too, you're cut off too, because they have to see, they always told us with PT and OT, you have to show improvement. And if you don't show improvement, well, they cut you off.
Right. Yeah, and that too. It's I guess just one tip is that when you are in the hospital, or if you are in a nursing home setting, they plan for your discharge, or they start planning for your discharge right away. Right. And they start to ask you questions. You don't maybe understand why they're asking you. Things like what types of supports you have at home, or who can help you at home. And I would say don't maybe overestimate the type of help that you can get, whether it's family or friends, because then they base their discharge plan on maybe someone that can help you once a week, but you actually need much more help. So just know, I mean, it's tough to keep track of, because if you're in the hospital or nursing home, that's the last thing you're thinking about. But definitely just know that when they ask you those questions, definitely don't overstate the help you get at home, because if you do that, then they might not set up the home therapy that you need, or any other services that are available through Medicare. So keep that in mind too, that some of those services might not be set up based on how they ask you those questions about what help you get at home.
Yeah, but that's the one thing is, I'm comparing, is these Advantage plans, is it better to go with a supplement, to keep a supplement, than to go with an Advantage plan? Do you get, for an individual, do you get, depending upon what you need in long term right now?
Right.
Is it best then to pay extra for a supplement plan?
So one thing I'll say first, so because of the program I'm with, since it is federally funded, just know the SHIP program will never, we can't actually tell you what's better than the other, but I can say that with Original Medicare, it can be easier to go wherever you want, because as long as they accept Medicare, you can go there. Whereas with the Advantage plans, you do have to work with networks, even if you have a PPO. The one thing there is that if you have a PPO, you still have to go to in-network providers to get the lowest price. Otherwise, you're going to pay a lot more still if you go out of network. Just another quick thing about the Advantage plans is, you may have seen this in the news where the insurance companies have been caught in a way where they have been denying procedures or claims when they weren't supposed to, or when Medicare does cover those tests and procedures. So Medicare has noticed, the government has noticed, and they have started hearings or investigations into this. But just know too that that's another part of where Medicare Advantage can be more restrictive, because sometimes they're denying things that they shouldn't or that can be covered. So that kind of gets to that point where it's just generally more restrictive with these Advantage plans when you need certain health care.
Well, that's, I noticed one thing that with, I'm sorry,
No, it's
noticed
okay.
one thing with myself even, if blood work was done, and then I'm told it's not covered. And then I call Medicare's not covering it. Then I call, this is from my insurance, says, the doctor's office saying it's not covered for a routine blood work. Well, then they said Medicare doesn't cover that. So then you call Medicare and they go, tell them to code it right. And that's the problem, you have to keep telling these doctor's offices, will you please code it? Medicare says it's covered.
Any of Bob's
That's
statements?
definitely a huge issue. So there's a lot of coding issues or billing issues that happen with Medicare, and unfortunately that really ends up just falling to you, because the providers or the doctors, they either don't know about it or they're not going to do anything about it unless you bring it up. So definitely keeping an eye on your Medicare summary notices. Those are normally sent out to you every few months. Is definitely look at those, because sometimes it'll say whether something is or isn't being covered, or that you might get a bill for something. So yes, it's like I said, unfortunately some of that means long phone calls to the doctor's offices, trying to, again, educate the billing provider, the billing people on how these things should be done. I mean, hopefully that gets better, but right, sometimes that takes you having to make these phone calls to get these things corrected. Right.
And it works out, but it's,
Yeah.
you have to be persistent.
Right. Yeah. I think you had a question?
Well, on the coding thing, I had the same issue, for like the A1C, they wouldn't cover the A1C, which they'd always covered before. And they said, well, try a different code, And they would only cover it if you had diabetes. Well, it was borderline, but they still would, somehow the coding wasn't right. I eventually got it, but it was a big problem.
Right.
Anyway, what I wanted to mention, my mother-in-law somehow got into an Advantage plan. And she was in the hospital for probably a week or so. And they wanted to put her in a nursing home to build up strength, short term. Well, they had to wait for approval. I don't know how many days they had to sit there and wait for Medicare to approve going into the the nursing home.
Right, yeah. I used to work in a hospital setting, and I would see that a lot. If you have an Advantage plan, that means you would have to go to a nursing facility that is accepted by that plan, and then yes, there can be kind of delays in getting that approved. I mean, if you're in the hospital, that really shouldn't be anything that you have to really worry about too much, because it really should be the hospital staff that is making those phone calls. I have seen that happen where sometimes you're given lists of facilities, and it almost, they make it seem like you have to call these facilities so that you can be discharged from the hospital, but just know that's not how it works. It should be the staff at the hospital that is handling your discharge planning. But yes, you can run into that also with these plans where you have less choices, or it could just be a little bit more difficult to get what you need. Okay. All right.
How would you fight that?
Sorry.
If they give you this list and tell you you have to do it, and you say, I'm sorry, I object, you have to do it. How do you get anything done there?
Right. I mean, that's, in the hospital, there are also, again, advocates that can help you if you run into that type of issue. But yes, again, that's like usually the last thing you're thinking about when you're in the hospital. So I would say maybe just keep in the back of your mind that you can appeal certain things in the hospital. You can push back. So if whenever there's something that maybe you don't understand or that you don't agree with, as far as your care that you're getting in the hospital, you do have options. You do have people that you can talk to, that you can reach out to, just to help you know what your options actually are. Okay. I know it's tough. Yeah, it's definitely difficult. So kind of going back to, I think we talked about some of the in-network and out-of-network costs, even the extra benefits. So usually through these Advantage plans, they do offer those extra benefits. Most of those are real. So things like the dental, vision, transportation programs. They even offer gym memberships. So that is something to consider if you are interested in those types of benefits, because usually those aren't available with just regular Medicare. And so kind of what we were getting into, but usually one of the most common questions that I get is which one is better? And it's not as clear, and even then, again, we can't really tell you what's better, but we can kind of compare the costs. But this is how the basic structure of what your options are with Medicare is. You either have original Medicare with the various different parts, Part A, Part B, your prescription plan, and then if you choose to, your Medigap or supplement plan. And on the other side is the Medicare Advantage plans that includes just about all of those benefits into one plan. And so one way that I usually try to explain this or show what the difference is based on the total cost for the year. So for example, if someone is maybe new to Medicare and is planning to enroll in a Medicare supplement plan, for maybe one of the top plans, supplement plans that cover just most things, most likely you're going to pay about $1,700 for the year for those monthly premiums. But that plan is going to cover really most of your healthcare costs. So you won't have to pay anything out of pocket when you go to the doctor. But then on the other side of that is these Medicare Advantage plans with these out-of-pocket limits, where at the lowest end you could have to pay up to $2,300. So in the worst case scenario for this person, or in this example, you would actually pay more under the Medicare Advantage plan compared to the Medigap plan. But then on the other side, say if someone is healthy, doesn't really have to see the doctor, or doesn't go to the hospital, then actually yes, they will pay less with the Medicare Advantage plan because they're not paying for these monthly premiums. There's also, so I would still consider that there are those extra benefits. There are still those sometimes pretty heavy restrictions about where you go, but I think this is one good place to start, is compare the total amount that you can spend in a year for your healthcare costs, and that could help you know whether Medicare with a supplement is better for you or the Medicare Advantage plan. And then just quickly, just so you have an idea of just some of the other services outside of Medicare that are available to you. So the agency I mentioned, Catholic Charities, they're the primary provider for these services in Will County. So there are services such as the Meals on Wheels program that you might know about. There are transportation programs, even financial assistance. And the nice thing about most of these programs is they're not income-based. They're more so need-based programs that are available just to as many people as possible. So if there was ever, I would say, just know anything else that you might be in need of, other programs, even caregiver programs that aren't normally covered by Medicare, usually there is another way that you can get that type of assistance. Go ahead. Oh, sorry, it's a more literal term. I should have changed this. It's just a more formal name for those same programs or benefits that I mentioned. So the caregiver programs or the financial assistance that are available through us and Catholic Charities.
So Illinois something?
Oh, it's the number 3. It's 3B.
3.
Yeah, sorry. That's the way we kind of know it internally, but just know there are these community-based programs. They're through the Older Americans Act that's been around since the 60s. So just know there's just free programs and benefits that are available to you, anyone over the age of 60 or people with disabilities. Okay.
What does that mean? Doesn't make any sense to me at all. What is it?
Oh, this is just an abbreviated name for those same benefits that I mentioned. So the CCU, that stands for Case Coordination Units. So these are agencies that offer caregiver services in the home, because Medicare normally doesn't cover if you need a caregiver to help you more with day-to-day needs. So say if it's, say after a rehab stay, if you maybe still can't, if you need help maybe getting dressed or with bathing or helping with household things like cooking and cleaning, through this, it's called the Community Care Program. Through this program, you can actually get those in-home services at no cost. You do have to qualify for this program. It's based on your assets. And assets would be things like what you keep in the bank or the value of any investments. But if you're within the limits, you can have this caregiver service at no cost. You have a question?
I'm still confused on this.
Sure.
Can you give a sample name of a company that would fall under 3B services?
So Catholic Charities. So Catholic Charities manages all of these benefits in Will County. So just know you would have to get in touch with Catholic Charities, and then they can actually set up those services for you.
And what would be a CCU?
Also Catholic Charities, actually. Same agency. So in other counties, sometimes it is a different office, but, well, actually, sorry about that. In Will County, it is actually a different office. It's Senior Services of Will County. They are the case coordination unit. If anyone is from a different county, there are different offices that do this same work, but we can always connect you with them. Yeah.
But everything is based upon your assets, right? For giving service.
For most of the services, no. Mainly the caregiver programs, the one through the community care program, that one, yes. They do look at assets in order for you to qualify. But another way to get caregiver services, this time through Catholic Charities, is there's a program called Caregiver Respite, where say if someone normally helps you out or cares for you, maybe once a day or just checks in on you every once in a while, but say if that person or that caregiver needs a little bit of a break, or if they won't be able to help you like they normally would, through this program we can actually pay for a caregiver to help you maybe for a day or two every now and then. But that one is completely free. There's no income requirements, no asset requirements. It's really more so depending on whether the funding is still available. But anyone can use that. Mm-hmm. Okay. And then just any other questions or any other questions? Yeah.
You wouldn't happen to know on the Medicare Advantage plans, which, if any, cover expensive drugs?
So not specifically, because there's so many different plans. I haven't had a chance to look at all of the Advantage plans based on the drugs that they cover. But that's
Something like this, but for the Advantage.
right.
Would be very helpful.
Right. It's mainly because there are so many plans. But that's where on the Medicare website, if you wanted to do it yourself, go there. It'll enter your drugs, and you can see all of the Advantage plans and see how it covers your drugs. But again, if you need help, we can always do that together. Any other questions? No? And I guess I'll briefly mention, so one of the brochures that I included, just in case, hopefully you don't have to ever need this, but it's about another program I work with. It's called the Senior Medicare Patrol. This is all about really just educating people on how to avoid Medicare fraud and abuse, whether it is a real scam or whether it is maybe just a billing error. I just know that there is a program that can either help you know whether it is maybe a scam or maybe even help you report this so that you can recover your Medicare benefits, because just Medicare scams are a huge issue. Every year, over $60 billion is lost to Medicare fraud and abuse. And I mean, just so you have a quick idea of some of the scams that are out there, there are home health scams. So if someone is offering you a nurse to come to the home, or maybe a physical therapist to come to the home. If a doctor doesn't order that, usually Medicare is not going to cover that. So you can't get most of these benefits that they're offering you unless you go through your doctor. So just a general rule is if you do need something that maybe someone is calling you about, or if you see a commercial for a piece of equipment or a procedure or test that you need, it's just always safer to go through your doctor because they can actually order through Medicare instead of someone that's actually trying to scam you. I guess one more something to look out for is people have been offered a new Medicare card that's either a chip or a plastic card or a metal card. There aren't any new Medicare cards being issued, nothing with a chip. Really, they're just trying to get access to your Medicare number so that they can then really steal your benefits. And that's why I mentioned definitely review your Medicare summary notices every few months just to make sure there isn't something there that you didn't receive or that you don't remember. And then you can always report that to us and we can try to get that fixed for you. Yeah.
This has just occurred to me. I've always wanted to ask someone their advice on number one, should you carry in your wallet your original Medicare card, or is a copy good enough, as well as for your supplement card and your other ID cards? Because I always feel leery about carrying those with me in case something happens and I lose it. So at least if I have only a copy, then I still have the originals at home. So what is your recommendation for what we carry in our wallets?
So I would say you don't have to carry it. I would say definitely store it at home somewhere.
Even a copy in your wallet?
Not even a copy, because it's still your Medicare number. And if you lose it or someone steals it, then they have access to your information. The difficult part is that almost always when you go to the doctor, they still ask for your Medicare card right away. I don't know why they do that. Most doctors and offices have electronic medical records, so they have your information in a computer. So I really wish they wouldn't do that. I think it's still safe to leave your card at home, even if they ask for it, because you can always call them later and give them your number if they really need it, but most of the time they don't. So I would say if you're comfortable doing it, I would recommend leaving it at home. Store it in a safe if you have to, because it's I would say guarded like a credit card, because if someone gets a hold of your information, sometimes they can use up your benefits, and then if you then need it later, sometimes Medicare won't cover you because it looks like you've already used it, but even though it was a scammer that stole those benefits. So I would say leave it at home. I would say test it and see if they're really pushy about still wanting the card, and ask them, like, why do you need the card? Just keep it on file. They have the number, or you can give it to them later. So, yes.
I keep a photocopy in my phone.
You take the card and input it into the system.
Sorry, what was this?
As long as they have
If they
the
can
ID,
log into
numbers,
it.
why would we do that?
Yeah, I'm not sure. He's asking that you're saying that the Medicare number is in their computers, it's in their records. Maybe if a doctor is still using paper records, I don't see very many still doing that, but even then, they should have a secure way of storing that information so that you don't have to carry your cards with you. So
Usually in the doctor's office is the first thing they ask.
Right.
For your information,
So that's where I think it.
insurance card.
Yeah, I think that's where I think it'll take just people pushing back and saying, why do you need my card if I've been here before? Definitely if it's a new doctor, then most likely yes. Maybe take it with you that first time. But if it's somewhere you've been before, they really shouldn't need that card anymore.
Thank you so much. Hopefully you learned a lot of new information. I know this is always very well attended and everybody seems to enjoy it just because it's great information for us to know. So.
TRIAD works to improve the quality of life for seniors by providing an opportunity for the exchange of information between public safety, social services, and seniors. There are no membership papers to fill out or fees to pay. Everyone is welcome to attend. Each month, we present a guest speaker on subjects that keep you informed and up to date on the latest scams, frauds, and other criminal activities. We also discuss safety issues, home preparedness, and staying healthy. TRIAD meets the fourth Thursday of every month. Contact the New Lenox Police Department at 815-462-6100 for more information.